Mr. Matthews. But sorry, Mr. Smith. My name is Alicia, and I'll be your discharge nurse for the evening. Can you go ahead and verify your name and your date of birth for me, please?
Matthew Smith, 7/22/58.
All right, perfect. Thank you so much for that. All right, so your discharge summary looks like you got quite a few medications that you'll be sent home with on today. First one being lisinopril, 10 milligrams twice a day. You have metoprolol, which is 100 milligrams twice a day. You have atorvastatin, which is 80 milligrams once a day. Aspirin, 81 milligrams once a day. And clopidogrel, 75 milligrams once a day. You do have a follow-up appointment with your cardiologist. Her name is Samantha Hart, Dr. Samantha Hart. And this date is 8/22/2022. So don't forget to put that on your calendar and make sure you attend that appointment. Your discharge instructions, I tried to make it as simple as I could for you. It says, so what do you do when you get home? So we want to make sure that you be sure to take all of your medication as prescribed. Don't skip any doses. If your medicines aren't working for you or you develop any adverse reactions, notify your provider. Together you both can come up with another treatment plan. Plan to take it easy for at least 4 to 6 weeks. Recovering from a heart attack does take a lot of time, so return to normal activity when the doctor has advised. Your doctor did make a statement about you joining a heart rehab program. This can definitely strengthen your heart and give you some energy and confidence. Please call 911 anytime you think that you may need emergency care. Do not attempt to drive yourself to the hospital. The signs and symptoms that I need you to be cautious about or listen to your body about would be chest pain or pressure, any sweating, any shortness of breath, any nausea or vomiting, sudden weakness or lightheadedness, a fast or irregular heartbeat. There is some lifestyle changes, so we do want you to stay at a healthy weight or lose weight if you need to. And if you're needing some assistance with that, we can get you an appointment with a dietitian, a licensed dietitian, to help you to come up with a plan in regards to your dietary meals. We do suggest a combination of diet and exercise because it helps you maintain these changes. So eating a heart-healthy diet that is low in saturated fat and salt and is full of fruits, vegetables, and whole grains. You can get more tips from the dietitian, but these can at least get you started. And make sure you manage your other health conditions such as your diabetes and your hypertension also. All right, so I did include some information about the acute myocardial infarction, or heart attack as it's most commonly known for. So a heart attack is damage or death of part of the heart muscle. The damage is caused by lack of blood flow through the coronary arteries. And the coronary arteries, so the heart, like all other organs and tissues in the body, require blood supply. So the blood is supplied to the heart through the vessels known as the coronary arteries. These special arteries pretty much wrap around the outside of your heart, and when the arteries suddenly become blocked, this has caused your heart not to work as well as it should. Okay, so that is what you experienced, and that is why you came to the hospital, and that's what you were diagnosed with. And so what they did to help fix that was the angiography artery with stent placement. I just gave you a couple of some information in regards to that, of the actual procedure itself, how it works, what are the risks, and then your home care instructions. Just make sure that you focus on the home care instructions because those are the most important things that you need to know. You wanted to make sure that you monitor the insertion site for bleeding, unusual pain, swelling, abnormal discoloration, or temperature change. Also, a small bruise is pretty normal. If you notice a large amount of blood, tell your healthcare team and keep the insertion site clean and dry. And do not take a bath or hot tub, nor swimming until the skin is completely healed. And you call your healthcare provider if you have any of the following in regards to fever or chills, increased pain, redness, swelling, bleeding, coolness, numbness, or tingling in the affected area where you had the placement, the stent placed. And just a few information about your medications. So what I did was I broke everything down for you. The actual name of the medication, the classification of the medication, how it works, why it was ordered for you, the common adverse reactions. So again, if you have any common adverse reactions, you want to make sure that you notify your healthcare provider. And let's see here. That's all. And Mrs. Smith, I know that you had a couple of questions for me. What exactly did you need some help with?
Yes, ma'am, I did. So he eats a lot of fast food normally. Is he allowed to eat fast food, and how often can he eat that?
Okay, so Mrs. Smith, with the fast food, we don't encourage that. We actually encourage you to limit the fast food intake. I mean, if you're gonna eat something out, I mean, if you're anything like me, I mean, it's like if I'm going out and I'm shopping out and about, I do want something to eat. So I would say stick to the leafy green vegetables, anything that's high in vegetables and high in fruits. Let's stay away from hamburgers, things that are really fatty in regards to oil. You want to lean more towards like fish, like the omega-3 fatty acids that are in fish. Those are really, really good for you. Control your portion size. So how much you eat is just as much as important as what you eat. So use a small plate or a bowl to help control your portions. You eat more vegetables and fruits, like fresh or frozen fruit, veggies. I know places like Chick-fil-A, they have like the little fruit cup or something like that. Just making those smarter choices or decisions when you're out eating. I think that would probably be best. Whole grain pasta and oatmeal. Let's see, whole wheat flour. So instead of eating white bread, eat 100% wheat bread. Little things like that. And then, any other questions?
So I'm trying to start him on a diet, and what foods are better for him versus fast food?
Okay, so again, eat more vegetables and fruits, fresh or frozen veggies and fruits, low sodium canned vegetables and canned fruit packed in juice or water. Select whole grains, so they pretty much play a key role in regulating your blood pressure and your heart health. Whole wheat flour, whole grain bread, high fiber in a serving, brown rice, barley and buckwheat, whole grain pasta, oatmeal, whether it's steel cut or regular, and just like I said, limit the unhealthy fats.
And just one more question.
Sure.
I'm trying to get him started on exercising too. When can he start since his procedure, and how much exercise is okay?
So, per my notes that I got here for you, it's, it does take a couple of weeks to start returning to normal activities. Recovery from an angioplasty and stenting is typically brief though, but walking, running, weightlifting, and any activity that raises the heart rate and increases the cardiovascular fitness can be safe after recovery from coronary angioplasty. We do encourage you, Mrs. Smith, to go ahead and book into a cardiac rehabilitation program, which is a dedicated program that helps to support you every step of the way as you heal to recover and get back to your normal routine. Okay?
Thank you.
You're so welcome. Any more questions for me?
No, that's all.
Okay, well, it's been a pleasure, and I hope you take care of yourself, Mrs. Smith. All right. Okay.